Okay, so today we're going to be talking about electronic health records and information security, and my name is Avery Thompson. So first we're going to be talking about the background of electronic health records. They were previously stored physically as paper charts, and electronic health records are an electronic way of storing those records. First EHR system was developed by the Regenstrief Institute. It allows members of a care team to work together in treating a patient. So previously with the paper charts, it's just one chart being passed around between a medical assistant, a nurse, a doctor, front desk staff. So it does make it a lot easier when it's all electronic and each member of the care team can access it at the same time if they would like, and it makes it more efficient. So EMR has 4 different functions: recording patients' clinical and demographic data, viewing and managing laboratory tests and imaging results, managing order entry, which is electronic prescriptions, supporting clinical decisions, which includes warnings about drug interactions or contra interactions. Now we'll talk about the benefits of EHR. Accessing and documenting in a patient's chart is easier. As I spoke on before, it's so much easier when each member of the care team is able to access the record at the same time if they would like, or input data quickly, much more than a paper record. So overall quality of patient care improves because the faster you're getting results put in, the faster you're able to get the patient better and give them information on what's going on. The quality of the patient care is going to improve. Also increased efficiency among staff. They're able to do their job quicker if they can just quickly jump on a computer and update a patient's chart rather than tracking down a patient record in a paper form. It also increases patient satisfaction and decreases time of patient stay because of that easier flow of communication. You're going to be able to do things faster and patients are going to be happier because of that. So now we'll talk about the legal and ethical issues. The main law here is HIPAA, which is Health Insurance Portability and Safety Act. There are 3 subsections of the HIPAA. The first one is technical security. That's going to involve virus protection, firewalls, encryptions. The main concern with technical security is data breaches, whether that's from an outside source or an employee within the hospital. Certainly employees could share information and that could be considered a breach as well. Physical security is going to include locks, cameras, and having restricted access. Concerns of a provider's computer being stolen, that certainly could leak a lot of information as they have patient charts and information on there. Also, administrative rules for employees. That could be employees sharing photos of a patient or their personal information, whether that be just texting it to someone or putting it on social media. There have been many issues with that. So now we'll talk about security concerns. 2,250 recorded data breaches from 2009 to 2018. 390 of the 2,250 are still under investigation. And the main reason that this is of concern is because employees are actually the cause of 58% of these breaches. So that means that employees are behind this and we need to make sure that our employees are being held accountable for these breaches. And also these breaches involve private personal patient information, meaning this is a pretty big issue if this gets leaked because it's someone's personal information about their health or just their demographics. That can be quite an issue. So now we'll talk about the future use and improvements. Continuing education for employees is always important. Having them be updated as far as HIPAA education and knowing what they're allowed to do and what they are not allowed to do, and also just having them be aware of what a data breach might look like from someone on the outside, and just ensuring that the physical security is there as well. That includes ongoing security updates and surveillance, making sure that everything is okay as far as that. Also, we need to work on better ways to introduce HR to increase staff comfortability. Anytime a staff is more comfortable with a system, then that shows they can be more alert to when something is not being done properly as far as other employees sharing information and data breaches from within the system. And these are my sources, and thank you for listening.